Good afternoon, everybody. Good afternoon. Welcome. Thank you for joining us this afternoon. It's a real pleasure to have you here. Today we'll be focusing on the medical field, and who better to lead this discussion than Her Excellency Dr. Jaleela bint Alsayed Jawad Hasan, the Minister of Health.
Thank you very much. It gives me great pleasure to be here with our future generation that definitely will unite with us to build our country and to further enhance the work in health sector, inshallah, and in all sectors.
Thank you. Please give a warm welcome to Dr. Jaleela. So good afternoon. On behalf of Bahrain Bayan School, we really just want to thank you for joining us here today and giving your time as part of our Career Awareness Week. It's a time that we dedicate to students to really mobilize the school resources, continue our professional learning, and really gain an insight into different professional fields. So it's something really valuable to us and our students. They're extremely excited. We've got several questions we've been working on, and we'd like to thank you for agreeing to answer those questions about the medical field. So without further ado, I would like to hand over to Lulua, who's going to be asking our first question.
How has the medical sector changed in Bahrain over the past decade?
The medical health sector has been growing over the last decades, and I want to let you know that Bahrain is a lead in the health sector since years. In fact, the first institutional health was in the region was in Bahrain. We had the missionary hospital in 1903. And this was not only supporting the kingdom at that time, but even extending the services beyond the borders, beyond Bahrain. So Bahrain was leading in health at that time and will continue, hopefully, to lead. And since then, there are a lot of development and step which has been taken. For example, in 1925, we had Muharraq clinics. And in 1938, this was followed in 1938 in Naim. And when you visit the museum, you will not see only that the health sector was there years back, but you will see that it is regulated with the timing. You can see one of the documents in the museum with a circular from government of Bahrain indicating the timing to visit the health facility, and it was written in 1939. So we have been there in terms of health, investing in health and health of population. The primary care as a gatekeeper, not only as an institution, but based on all the aspects of primary care, has been established in 1979. And this was preceded by having the hospital, Salmania Medical Complex, with the secondary care and maternity care that reflected in reduction of maternal mortality since 1957. In fact, all the people and all the globe and international organization today talking about universal health coverage. And again, when you go to the museum, you will see that Bahrain is pioneer in this. We have universal health coverage years and decades back, where everyone has been treated freely and according to their need. The services were available, accessible, and of high quality, and for everyone, leaving no one left behind. And even at time of diving, there was specific clinics for divers to ensure that there is a health, and the health is provided for everyone. And with the development process led by His Majesty the King, the King Hamad bin Isa Al Khalifa, Hafadahullah, this development process took the health sector as one of the cornerstone, and even in the governmental projects that followed by His Royal Highness the Crown Prince Salman bin Hamad bin Isa Al Khalifa, this is a very important pillar in the governmental work. And this is why we are here collaborating with you and with all the sectors to ensure health for all, by all, including you, because it is a shared responsibility.
Thank you very much, Dr. Jaleela. And thank you, Lula, for that question. We'd now like to hand over to Ali for his next question.
Does the MOH, the Ministry of Health, collaborate with other ministries such as that of education or tourism to contribute to the country's innovation and growth?
Yeah, thank you very much. We are working as Team Bahrain. We collaborate and coordinate with all partners, which include ministries, governmental and non-governmental institutes and facilities to build a culture where everyone contributes to the health. And in fact, we have a school health program with the Ministry of Education where we ensure that promoting health even for children from nursery to kindergarten and primary and elementary and thereafter. And there are several programs done in collaboration with Ministry of Education in relation to training of workforce, which is already fit to the health sector. So it is collaborative work, which is continue with Ministry of Education and also with Ministry in relation to tourism and with other ministries, where we have the medical tourism is in the agenda, and we have the visiting doctors and others. So all of these collaboration is continuing. And just recently, it has been announced to have 5 of our universities as universities which is promoting health and supporting health to be one of the first achievements in the region, to have 5 universities that is certified as health-friendly and health-promoting universities. So we have a strong collaboration and coordination with other ministries, with the civil societies and with the communities, and we share all together any decision that support health of any individual.
Thank you. And a collaboration has been something that's come up quite a lot this week as we've talked about different careers as a really important thing for success.
It's collaboration and cooperation always there.
Yes, definitely. Thank you, Ali. Okay, we'll now hand over to the next question.
So students mostly decide to enter medical school to become medical doctors. However, what other medical-related fields are needed or in demand in Bahrain?
Medicine and medical field is a noble path. So it doesn't know age, gender, or others. So any part of it will continue to be important because we have to have sustainability of health and quality. And this is very important when a person selects this path and specialization, not consider the need and how much he can add, because it is a noble path, as I mentioned. There is a need and will continue to be there in a specialized profession with the advance in medicine and medical health profession and even allied health, nursing, specialized nursing. And it is not only restricted to Bahrain, but even beyond boundaries, it is required and needed in Bahrain and in other countries, especially in specialized nursing and specialized medical professions. Also, as you know, and all of us know, with the globalization and advance in technology and innovation, so medical-related innovative specialty and technological, which is related to personalized medicine and artificial intelligence, also in demand because we are growing and advancing in medicine and utilizing of such science and bringing it to what is currently available will be definitely of value. So there will be a continuity of need. However, it is always should be tailored with the reform of medical, of the health system. And accordingly, when a person selects any field which is on demand, should discuss it with the people who are working on that field to make sure that he is fit and he can accommodate and cope and adjust with the requirement of this field. So specialized medical professions and nursing and allied health.
Thank you. Thank you. Now, Mesa, your question, please.
From your experience, what skills do students need to master in for today's world in order for them to succeed?
The skills. It is noble path, as I mentioned. So it is touching people's life. So the human touch is always need to be there. So going to medicine, a person who go to medicine should be dedicated, responsible, ethical, problem solver, and adapting and accepting for others, non-judgmental, which is very important, team player, and value the human life. This is a path that touch everyone. So all of these are very important. Of course, the person should have the curious mind, because you always search for answer. Living with uncertainty is one aspect, but ready to adapt and have this adaptability with the change and coping mechanism, studying all the aspects of something, accepting to compromise when it need to compromise, and ensuring that they would do all their best for others sometimes is very important, because this is not any job. It is a job with passion. So if you have the passion, go for it. Passion, hard work, problem solving, and dedication and responsibility. Passion, and passion. Again, I'm repeating that, because if you love it, you would do it perfectly. This is what I do believe on.
Thank you very much. Thank you. We'll go back to Lulua for your question, please, Lulua.
What are the hardest challenges facing the medical industry in Bahrain?
I will say Team Bahrain will continue to release challenges and driven by their passion to achieve and for achieving our goals. So even if there's challenges, we will convert them to opportunities. And this is what we learned in COVID. There are global challenges everywhere, but we succeeded to overcome these challenges and became a lead in the globe in our performance. So we do believe that these challenges are opportunities for us to succeed. And in fact, what are facing the health sector in Bahrain is what is facing the other countries, like the misinformation with the growth of social media, and ensuring that everyone get the proper information from the right source, and ensuring that we have the answer for certain questions, which is uncertain, and the information will be available with time. This is one of the challenges for all the globe, with emerging diseases, emerging infection, growing population with their own challenges related to disease, availability of medical services globally to counteract the emerging diseases, and ensuring that proper supplies are available globally, because we are in a country where we think that everyone make a difference. We don't limit our resources to a certain nationality or age. So we are ensuring that it is available for everyone, and with the humanity, extending our available resources in terms of knowledge, sharing experience with others. So our challenges is our opportunities for improving health sectors and improving overall performance.
Thank you for that question, Lulua. Now over to Ali for your second question.
So since COVID, many countries have decided to embrace virtual health services. How does Bahrain fare in terms of this trend?
Yeah, virtual medical services, including telemedicine. In fact, Kingdom of Bahrain started the telemedicine even before COVID-19. And it was there in the primary healthcare and even in secondary healthcare in relation to repeated prescription, teleconsultation, in relation to lab results, and even radiological investigation. And just recently, the Ministry of Health and Primary Care has been awarded in in the sector related to the teleconsultation as a topic as one of the best practices done in the region. And based on that, and based on what has been done during COVID, there is an advancement on the use of this technology, which is either video communication or even just teleconsultation, and following up the patients, and even in delivery of certain medication, and ensuring the safety of everyone. And with this, we have seen acceptance, public acceptance to this technology, and we are building on it and building on utilizing technology, including the artificial intelligence and robotic in the primary and secondary care sectors, in the government and the private, both of them.
Excellent. Thank you for that, Ali. Ali, would you pass the mic over to the ladies for the next question, please? Thank you.
Congratulations on running a highly successful COVID response operation. Has the pandemic
Thank you very much. And I would like to take this opportunity to thank everyone in this country, because the success is success of all, Team Bahrain. The effort which has been led in Bahrain, it has been with the direction of His Majesty the King, where all the services provided for everyone free of charge, as you know. And the efforts led by His Royal Highness the Crown Prince to ensure that everything done at the level expected. We learned that the war room, which was established early on, which is proactively, and preparedness is an essential factor for success of any operation, which include especially in health. So preparedness, planning, with strong leadership, which is available in Bahrain, is a cornerstone. We have a strong infrastructure in health system, which allow us to succeed and to have our case study to be published by World Health Organization. And we learned that multilingual media campaign, which is proactively done with partnership with all the sectors, is also an essential element, because engaging everyone in the community, engaging all the sectors, is also very important in your planning and in order to take a proper decision. So all of these are important learning lessons, in addition to adaptability and resilience of the system, which allowed us to swiftly succeed in implementing several factors and several pillars, which include the preventive, curative, and early diagnosing of cases during COVID. And from there, we are building our system to ensure preparedness, timely and proactively acting in case not only of emergency, but also building on during the reform, which is the health sector is passing through now, which is the reform shifting to the health insurance system to ensure the universal health coverage will continue and will be further enhanced.
Thank you. Thank you. And our last question.
Do you have any last recommendation or message for our graduating students?
You are the future. For any country to succeed, it relies on the people. And in the development process, always we are reminded that investing in the human capital, in the human resources. And I do believe that you, during your education, you can grasp the maximum and learning from each one, because everyone make a difference. And you will make a big difference in our country, because you are the future. Work with passion, work hard. You are part of Team Bahrain. We are one family working together to build our country and to be the lead in everything. We rely on you, we believe in you, believe in yourself, chase your dreams, and you will do it. Love what you do and do what you love. And thank you very much.
Very wise words. Thank you so much. We really appreciate your time here today. It's really been great. We'd like to open the floor to questions from our lovely audience. Does anybody have any questions that they'd like to ask Dr. Jaleela? I think you've answered everything so well.
Thank you very much.
That's great. No, but really, Your Excellency, we really do appreciate your time, and we'd love to welcome you back to unpack more of these really good topics that you've brought up today.
In fact, it's my pleasure to be here, and I'm grateful for Al Bayan School and for any education institute that ensuring that our students, our future, select their career path based on informed decision, because we learn data-driven decision is the right decision. And I wish everyone the best of luck. Thank you very much for the hospitality and for this session.
Thank you very much. Thank you. And thank you to our students as well for asking those questions. I hope they weren't too challenging. They really practiced. We're trying to get the right questions for you that they chose.
And they did ask great questions. And I am looking forward to see, maybe if not all of them, some of them in the medical sector with innovative projects and innovative bath.
And that's one thing. One thing we were discussing yesterday with some of the students is if they are interested, we've talked about the skills, is there other things they can do now to prepare for that journey into the medical sector?
Yes, of course, they can always be trained, and maybe they do clinical attachment to see how the people practice in reality, or they can also see some of the read certain articles about the health profession, because reading always good, and see certain I will not say movie, but certain events and how people acted, because medicine, as I mentioned, it is different than other career. If it is selected, it needs sometimes to be to give time, effort, and passion, because this is a people life. This is not anything, and people life make everything.
Thank you very much.
And we are here for them. All of them are our daughters.
Okay, thank you.
And
Another
sons,
round of
course.
applause for Dr. Jaleela. We really appreciated your time. Thank you
Thank you
so
very
much.
much. Thank you.
Thank you, everybody. Thank you very much.
Thank you very
Cheers.
much.